When you cough, do you have COVID-19 right away?
Or, if you are experiencing fever, is it COVID-19 already?
This is one of the misconceptions of many Filipinos, which represent in our ignorance about this contagious epidemic disease, the COVID-19. Coronavirus disease or COVID-19 first started at Wuhan, China last December 2019. Since then, it has spread fast over the world. On January 22, 2020, the first suspected case in the Philippines was investigated by the Department of Health. On January 30, 2020, they confirmed the first case of COVID-19 in the Philippines, who was a female Chinese national. Now, there have been 1,403,588 confirmed cases of COVID-19 registered with the WHO or the World Health Organization as of June 28, 2021, with 24,456 deaths and a total of 9,542,612 vaccine doses have been administered. There are several symptoms associated with COVID-19. These may also be symptoms of other diseases. COVID-19 symptoms are listed as follows: body aches, chills, dry cough, fatigue, fever, headaches, itchy eyes, loss of taste or smell, nasal congestion or stuffy nose, nausea, vomiting, diarrhea, runny nose, sneezing, sore throat, and shortness of breathing. A cough, for example, is one of the COVID-19 symptoms, which is also a common ailment. In today's epidemic era, when a person experiences a cough, they immediately think it is COVID-19, which may occur in anxiety. As a result, most people are in doubt to visit their doctors and are worried of associating with others, especially their compatriots and those who are experiencing COVID-19 symptoms, since no one wants to know that he or she has COVID-19. The relationship between lines and points is described by a graph. The point is called the vertices, and the line is called the edges. In graph theory, edges is a connecting line between two vertices which represent that these two vertices is related to each other. In the connection of graph theory to the COVID-19 will be explained as follows. The symptoms and the diseases are the vertices of our graph, while the edges are the time interval when the patient feels a particular symptoms. Under the vertices, we have the following diseases that are related to COVID-19: allergies, cold, flu, and the COVID-19 itself. Also, the symptoms of COVID-19 that we explained earlier before. For example, allergies, cold, flu, and COVID-19 have the same cough symptoms, but they are different between the time interval when the symptoms is felt by a patient. If you have a history of allergies, your cough is most likely caused by it. A chronic allergic bronchitis cough is lasted for more than 3 weeks, while acute bronchitis cough is lasted up to a few days or a week. A cough in a cold is lasted up to 1 to 2 weeks, same as the flu, but it is also depends on the treatment. In COVID-19, cough is lasted up to 10 to 14 days, same as other diseases, but COVID symptoms generally appear 2 to 14 days after exposure to SARS-CoV-2 virus, while a common cold usually appears 1 to 3 days after exposure to a cold-causing virus. In addition, we have 3 categories in consulting a symptoms: rare, sometimes, and always, and it will also be a factor in determining what disease we have. So, don't immediately think that when you cough, you already have COVID-19, or if you feel the symptoms at the same time, because there are other diseases beside this contagious disease that even have the same symptoms, but the time interval when it is felt by a patient is different.